I've no watch. I think it's about 7 o'clock. That clock says just past. The computer's not quite sure. So we'll start. Nice to see everyone, and what a lovely evening to come out on. Yeah, no, Alison, we could have been in the garden. But thank you for coming. Hopefully it won't be such a long meeting. Do we have any apologies?
Yeah, apologies from Melanie de Jong.
Thank you. Any declarations of interest? No. Any public questions?
No.
Town and parish questions? No. Councillor questions?
No.
Okay. Before we get into the next item, I'd just like to say congratulations to Matt. We had the results of the inspection on adult social care last week, and I don't know if you'd seen it, but we'd done exceptionally well. I'll give Matt just a minute or two to say how well we did, and then we can all congratulate him because the staff have worked exceptionally hard. Matt.
Okay, thank you. Yes, we did really well. Ranked overall third in the country so far. Good overall with a couple of elements of outstanding. I think we sent a bit of a briefing out to everyone. You know, a team effort really, not definitely just not me. A whole team effort, not just in the council, other departments of the council, voluntary sector partners. Our providers that provide hand-on care. Helen's here from Optilis today. You know, it's the whole, that it looks at the whole social care operation. So really, really pleased with the outcome. Always places to improve, and always, you know, wanting more funding generally, but you know, really, really, really pleased with the outcome. And happy with that.
Thank you. Well done to all the staff. Again, I'm sure you'll pass that back to them. Right, item 26 on the agenda, and the only item on the agenda for this evening, is transfer of the Physical Disabilities Day Service from Westmead Day Centre to Matthews Green Community Centre and the future of Westmead site. Matt, are you speaking with this?
Well, I'll just do a brief intro. So intros, in terms of officers here today. Helen Woodland hasn't got a name tag. I think that's my fault because I forgot to mention that I was bringing Helen along. Helen is the Chief Executive of Optilis. Optilis provide the care and support to this service in the current location and in the new proposed location. And Chris Clark is from our commissioning team. He's been sort of leading on the project, so I thought it would be useful to have him along to take questions. You've got a paper, so I'm not going to do that thing where I present the paper all back to you. So I'll just do a bit of a summary, and then you know, let's move to questions as quickly as we can. So Westmead is a service for people with physical disabilities. It used to have quite a lot of people attend, but over the years that's reduced down. So we're only talking about 17 people here in total. The building at Westmead is coming to an end of life, although those people have been in that service for a long time. We have a new and unused community centre at Matthews Green. So the proposal is to relocate the service, not just relocate it, but relocate it with a view of reinvigorating that, modernising that, and hopefully that developing and growing as we go forward. We think this is an exciting opportunity and a good thing to do because it kind of keeps the service going. Many of the people there have been there for a long time. Change is unsettling. So, you know, there is that element of the worry that change brings for people. We have run an engagement exercise with those people. We can talk a bit about that, through the questioning, but that started in June, and there have been groups, individual meetings. There's been a lot of engagement there, and we feel we've managed to, all of the issues that people have raised there, we've found solutions for. As part of the move, you'll see in the paper, we're looking to rationalise the days. And that's because the numbers have got to a place where there's very few people there on some days. So what we're doing is looking to rationalise, consolidate the days from 5 into 3, but still offer the same level of service to people. And that only affects 4 of the people out of the 17, and solutions have been found for those 4. I think I'll leave it there, otherwise I will do the thing I said I wouldn't do. And then we'll move to questions and we'll fill the answers.
Thank you. Any questions? Alison?
Hello. Now, I read on the council website that Westmead has a large and fully accessible garden that offers individuals the opportunity to relax and enjoy fresh air and do some gardening. And on the Optalis Facebook page, it talked about the fabulous outdoor space available at Westmead. Now, I know in the report it says that some activities available at Westmead, such as kiln pottery and woodwork, won't be possible. What about gardening? Is that possible at Matthews Green? Because I didn't hear any mention of the outdoor space within the paper.
Yeah, there's a very large patio area that comes with the Matthews Green Community Centre. It's not as large as the garden at Westmead by any stretch of the imagination, but one of the activities that we've included in the design is vegetable and flower gardening using raised beds. So part of the additional equipment that we're purchasing to bring into Matthews Green are some raised beds and a shed to store gardening equipment. That's our starting place. We're also looking out to the community to see if there's any community gardening projects that are more integrated that the people using these services can also take advantage of. We've wanted to try and make the service as much a like for like as possible, but there are going to be differences, some of which create opportunities, some of which at the moment would create limitations, but we are trying to look for solutions where, in particular, people have expressed an interest in continuing gardening.
Mike? Sorry? Yeah. Sorry, Rebecca.
Don't worry, thank you. Matt, thank you for the report. It's quite comprehensive and it has covered some of my concerns. I'll be completely honest, I've been contacted by residents in Finchampstead that it's affected. And I have gone back to them and said, do you still have concerns? Because we have this meeting today, and they haven't replied. So to me, that's a good sign that hopefully their concerns have been addressed. And the services that you offer are obviously quite unique and bespoke for us, and the needs are quite specific for the people that attend this centre. So covering that and reducing it down to 3 days. You say that people are being supported. For those that haven't been fully happy that they've been offered support, can you give us a bit more detail on what that actually is? Or, I don't know, without obviously breaking confidentiality and those things.
I will. The second part of your question I'll handle on to the people that have got the detail. But I suppose what you said there, definitely when we announced this is what we wanted to do with people and said we want to talk to you about it, a lot of concern came out then, which is what you've heard. I'm pleased you haven't heard back, because we have worked really hard with people to get those fears and concerns out, go and have a look round, talk about what we design and relay those. But if you do hear them, we want to hear, whenever, because solutions can always be found. So that's good. In terms of the some of the specifics, do you want to answer Rebecca's question on that?
Yeah. So we, through our consultation with the people that use the service, we talk to them about what they currently do and what we might be able to do when we move. And it threw up a lot of things that currently don't happen that could happen. So that, I think, was really encouraging to hear. And there were a particular couple of people where we wouldn't be able to necessarily transfer what they currently do to the new service. So we've looked at alternatives for those people, and they will sit outside of Matthews Green. They're not necessarily associated to Matthews Green. And lots of effort has been put in to make sure that we can accommodate what the people want to do, because that was really important to us, that, you know, this service will close and transfer to Matthews Green, but people still can do what they like doing and enjoy doing. So I think we've pretty much been able to accommodate that. We will be able to accommodate that with a new move. I don't know if you want to add anything to that, Chris.
Yeah, I mean, just in terms of process, so we started the engagement process with an on-site meeting down at Westmead with all of the service users. That was the 9th of June, if I recall correctly. That's where we first described the proposals to the service users. So right at the start of the process, what we were working with was a big long list of unanswered questions. Will I be able to do this? Will I still be able to do that? Are we bringing this activity with us? And we've used the time since then to work through all of those questions and continue to answer them, which has provided the people using the service with more reassurance about what their day service is going to look like. There's clearly a great deal of attachment and affection that they have for a service that's been around for such a long time. And they've been really involved in wanting to choose what the new service is going to look like and what activities we bring with us. Where there's been specific concerns, we've always had a social worker available to link directly with the person and their family. And that's where we've been able to work out specific solutions to specific concerns that they've brought up. And as Helen says, that might involve finding an activity in the community, and staff at Westmead will continue to be involved in supporting people on a one-to-one basis if part of their day service is out in the community and not at Matthews Green. So we've aimed to do a kind of continual update as we develop options with people and provide them with updates. So we're now at a stage where hopefully we've got most of the questions, well, I think all of the questions answered and all of the issues resolved, and we're ready to kind of go live with it.
Mike?
Thank you, Matt, for a very useful report. I do have a number of questions, but I'll do them one at a time, I guess. I'm slightly concerned as to, we used to have over 50 service users, and it's dwindled down to 17. And I can see a bit about the setting doesn't attract the younger people, but what is the core reason for it? Because presumably we've still got similar sorts of numbers of people requiring that sort of facility. Are we in competition with private suppliers?
I don't think it's so much that as you've got your sorry. It's not so much that as in 1993 when this was when I think Westmead started, people sort of want an expectation of what they do during the day to support families has changed. So people do now a much more diverse range of things. People will take direct payments, work out their own solutions, use ordinary facilities in the community. But there is a sort of core cohort who that doesn't work for, and that's the cohort that use Westmead. So sort of naturally over time, people have just made different choices and the numbers have come down. We do, though, think by relocating the service, having it in a community centre, doing different activities and interesting things as we go forward, that might attract more people in and make that service more sustainable while still running the kind of much loved element for the people that use the service at the moment.
Sorry, you mentioned.
Oh, I'm doing it now.
You mentioned about direct payments. I have no idea what those are. But forgive me.
Yeah, very simply, a direct payment is if you have a social worker that comes and assesses you and says you have these social care needs, unmet social care needs, the council can arrange for those needs to be met for you by using a range of services or different support, or you can choose to take the payment for that directly and manage that from the council, and then do that yourself. It's very commonplace. I'm going to say about, it's 31% of everyone that gets long-term care and support from us does it by taking a direct payment. It's a kind of more and more popular method of arranging your care in a way that makes sense to you.
Yeah.
Not for everyone, though.
So we're moving it from a dedicated facility that we've had for donkey's years into a community centre. Is it going to be dedicated facilities in the community centre? And how long is the tenure that you're getting there? Because presumably Westmead could have carried on to infinity, so to speak. But as a community centre, then presumably there's a limited tenancy?
No limited tenancy. The way the arrangement is set up, it's a council-owned building. There is an operator that will operate the community centre going forward, but we've arranged it so that those 3 days are for this service for, forever, I suppose, And I suppose the issue with Westmead is it couldn't have gone on forever, just simply because the state of the building really was getting more and more difficult to repair with asbestos and things that really it's come to the end of its life. So there's no time limit to the tenure there at all.
And there's no time. Presumably the school is a trust, operated as a trust, is it? And they have a lease over the school grounds for 110 years, if it is a trust. The community centre is completely separate from that. It's not tied in any way. Okay, and what about safeguarding issues with the children in the school and the users of the community centre? How does that work?
Well, answering the first bit first, it's not anything to do with the school. The community centre is a council-owned building. It's ours, so there's no issue there. I mean, in terms of safeguarding, we in the same way that the school would have its own safeguarding procedures, we have safeguarding around in what we do. I don't see a conflict between the two, at all. People. These are people that are out about in the community all the time. People mix all the time, so I don't see any issues there, or that's all managed. Helen, you might want to talk about how care and support is sort of arranged to provide those safeguards.
Yeah, so from a staff team perspective, all the staff are DBS checked to the highest level, including children. So there'll be no concerns from a staffing element there, and we'll be entirely separate to the school. So what we do won't interfere, and what the school does won't interfere with us. So we'll be operating entirely sort of separately. So we don't envisage there being any certainly any concerns of any kind.
Maybe it's not my first time, so I'm not sure whether I should be asking all these questions.
Could you put your microphone?
Yeah. Okay. lost my train of thought. The staff involved at Matthews Green, they're all at Westmead, they're all transferring and also remaining the same opportunities, or are they different now? They're only 3 days a week, and does all the equipment or whatever have to be put away so the community centre can be used for another use for the other 2 days?
So the staff we currently employ at Westmead will be transferring, and our intention and our hope is that we will grow that team as we are able to attract more people to use the service. That we will grow the team there, and we'll offer more and more to more and more people. In terms of the layout, we've got a dedicated area that will be ours to use, and there'll be we'll be purchasing some new equipment to go there. Tables that will fold down and potentially chairs that we can put away. And then we're planning on having this interactive TV that the customers have told us that they would like, that be for our sole use whilst we're there. But once we share that space, I guess there's the potential to share some of the things that we have there, and vice versa with the company that will take over the management of the centre. So.
Anything else, Mike? Anyone else? Any more questions? Nagy?
I was going to ask about reasonable adjustments. Are there any reasonable adjustments made to the community centre?
Yeah, so the community centre's been built and designed to a compliant, in fact above compliant accessibility standard. So people with mobility needs, wheelchair users. So in terms of accessing the building, moving around the building, that's built into the design. In addition to that, we've got specific accessible toilet facilities and also an accessible changing places facility, which is a national design for an accessible, not just a toilet, but a place where somebody can go and get changed. That won't be exclusively just for the people using the day service. That's part of an asset within the community, as part of the community service. So it now means the local community will have access to a changing places toilet. The kitchen there, so cooking is part of the day service model. The kitchen there has been specifically designed for accessibility. It's got cooking hobs that can be raised and lowered to meet need. There's cupboards at multiple heights. So we do cooking at Westmead at the moment, and that means we'll be able to bring all the kitchen equipment over and do cooking at Matthews Green. So very much been designed with accessibility in mind.
Much better.
Yeah.
And I think that, I mean, when we were thinking about this, we looked at lots of different places. Matthews Green, that was the forefront of our mind. Some of the people that use the service do have large wheelchairs, so having something that is super accessible in the way that Chris set out was one of the reasons why we've plumbed for this location.
I'll try and remember myself all these questions. So with the report says there are 5 service users that are going to be affected due to the number of days changes, or 4 maybe. Yeah. So how are we going to deal with it? So, or what is the impact on those service users?
Maybe I got 4 wrong and it was 5, and if I did, I got that wrong. But Chris will know the detail. I think Chris and Helen.
So the 5 people who are affected because they currently attend the day service on either a Thursday or a Friday, and the 3-day service at Matthews Green will run on a Monday, Tuesday and Wednesday. So of the 5 people impacted, as I was mentioning before, we've had an individual conversation with the support for social worker. 3 of them have agreed actually they'll happily move one of their days onto a Monday, Tuesday or Wednesday so they can still get their full day service. A 4th person has identified an alternative activity in the community for them to do on their 4th day, and a 5th person recently visited a community-based woodworking I think they're a charity, if I'm right, with the support, a one-to-one support of an Optilis care worker, they've agreed that actually that's what they'd like to spend their 4th day doing. So they will attend Matthews Green on a Monday, Tuesday and Wednesday, and then do an out and about community activity on their 4th day. So in all 5 cases, we've been able to come to an agreeable solution that they're happy with.
Good to hear that, thank you. And with the change in location, the Westmead is about nearly 3 miles away from the Matthew Green. So how is the transportation, or how is that being?
Yes, so it wouldn't affect people that we do transport to the service, because the difference is minimal, and then other people make their own way to the service, and that hasn't been an issue. It hasn't been raised as an issue for them to be able to get to the new service. So we don't envisage that being a problem at all.
Yeah. Yep. So for some of the service users, we support them with a minibus transport. So we've got a place to park the minibus at Matthews Green, and for others where they have arranged their own transport, were there to be a cost impact for that, it would be captured within their direct payment arrangement. We've not identified in any case where there's any impact. The locations approximately, I think I've said in the report, about a 6-minute drive apart. So they're not right next door to each other, but they're in a similar part of Wokingham Borough.
Thanks for that. Last 2. So because the community centre is being used 3 days, and how easy is it for it to be used by other users for the rest of the 4 days? And on the same lines, have the community around the centre been informed about this potential usage of the community centre?
And so Matt mentioned that when we open the centre, we've appointed a company to effectively run the day-to-day operations of the community centre. So Optilis will be running the day service. The property management will be run by a separate company, and part of their service agreement is that they advertise the space to the local community. So we expect on the other days for there to be a very wide range of organisations making use of the space to the benefit of the local community. And we hope over time that actually the day service and the wider community services and offer complement each other to the benefit of the day service users. I forgot the second part of your question, sorry.
I can answer that. So I suppose the functioning of the community centre, is a bit separate to the service we run, but the organisation that's been appointed to do that, Reading Rep, I believe are working with property to bring that forward or open that up fairly soon. Part of that, there'll be an engagement with the community and a kind of communication as to what happens there and what's available, and that's part of the kind of condition of that lease. So I don't think I can give an exact date for that, but we're talking to that organisation, about the relocation of the day service, and I would say that was sort of fairly imminent.
Is there a place to put any of the disability equipment while it's being used by the other people, the 4 days to make it safe, in other words, for everybody?
So yeah, so the space will be made safe for other users when we're not in the centre, and some of the people that we support do have larger pieces of equipment that would be difficult to put in a cupboard or anywhere else. So they will be, some of the larger chairs that we're going to be purchasing and having there will be left out. And I guess the relationship that we foster with Reading Rep when they take over will be one where we we will, have full interaction with them, and we'll hopefully be joining the events that they put on and the things that they're holding on in the centre, and they can potentially join us too. So we are hoping to have that kind of like fully interactive relationship with them, and we've already started that journey. We had a couple of meetings with them already, and I think it will work out well. What we're planning to do together.
Storage has been a hot topic, hasn't it? For discussion,
Any more questions?
I'd just like to understand, is St Matthew's Green Community Centre currently in use, being hired by any community groups who want to use it? And when was the building completed and handed over to the Borough Council?
I'm not sure I can answer all of that. I can answer the first bit in that it's not currently open and being used. So from a service point of view, there's something that's not open and would be suitable for relocation. So we've taken that. But when it was built and completed and handed over, I'd have to ask our property colleagues to provide a written answer, unless somebody here knows the answer to that.
I know in 2018 the executive were considering that they were moving forward with King's Church. They were going to be a leading partner in developing it, and we're going to put some money in, and then they pulled out. And obviously we haven't found a new partner until we announced one in January 25, which is a massive gap. But I presume it wasn't perhaps the building hadn't started in 2018, but I know this is separate from this committee slightly, but it slightly worries me that possibly we had a borough asset that hasn't been in use until now, and from everything we've learned and in the paper, thank you very much for all of that, it does seem the right solution for the Westmead Centre, because in a way the report in 23 highlighting how poor it was, it's shocking really that we stayed there that long. And I know what a fantastic facility it is, because I read the Health Watch report from 2015, which was glowing. So one of the things I really hope is that you can certainly attract more residents who'd really benefit from this, because I can see one of the huge benefits is stopping isolation. I'm not going to say this right away. Isolation, as well as helping people develop some skills, but enabling them to, get out and meet people, make their friends, and it's making such a difference. So, what's the maximum number that you think? Asking Helen here, what's the maximum number you could accommodate so that everybody got the most out of it still?
That is an interesting point, because we've been just working on the basis of the people we've currently got, and our plan is to encourage as many people as we possibly can to go to the centre. From a staffing perspective, it could be quite a lot, but I guess it would very much depend on the needs of the people that we are attempting to support at any one time, and that would kind of have to be reflected really as to how many people we could have in the centre at one time. So it's not by any means a definite answer to your question, but we want to support more people, and it would be very much needs based as how many people we could support at once.
I presume if people are coming forward and the needs there, and they bring the funding with them, you could expand to 5 days a week.
I think we very much could do that, yeah. The rationale to rationalise the days was because of the decrease in numbers. So 3 days seems comfortable with the amount of people that we've got. We can certainly increase the numbers even on those 3 days. But should we get to a position where we could increase to 5 days, and if that was an option, then absolutely yes, we could. Whether that was commissioned or self-funding people.
I mean, all I was going to say was we would be absolutely happy to come back. If the decision is made, we're looking to move perhaps early October, we could come back and give an update to this committee. You know, how's it gone? Have we realised some of the benefits, and is it busier? You know, that sort of thing. We could definitely do some of that, I think.
Yeah, I see the provisional moving date's the 6th of October, so perhaps a little bit later when you've settled in. But I really think, and I'm sure Matt knows, that there's a lot of people with physical disabilities who would benefit from this. And my only concern would be, you know, finding somewhere that suited the number of people that you've got now, when, I mean, I'm sure you can tell me how many hundreds of people there are, if not more, in the borough that, you know, when this is, I was going to say sold to them, but you know what I mean, highlighted and promoted, and, you know, they can come and see, just even the pictures, that this is a modern, vibrant, well-equipped, safe, warm centre, then I'm sure it can grow. And I just hope that we can enable everybody who wants to attend.
Actually, Matt, you've answered partly my question from Alison's question. You've got a lovely dedicated facility that's ageing and severely in need of repairs and upgraded by looking at the list of things here, which is going to cost a huge amount of money. You're going into a new facility with pretty much a new service offering and a new way of working and a whole bunch of other things. So the change is going to be massive. So I'm wondering, what processes are you putting in place to monitor how well that change is going? Because there's no plan B. You can't go back to Matthew Green if it doesn't work.
I guess from an Oxley's perspective, this is really exciting for us to be able to offer this facility to people. It's modern. It's you know, we anticipate it being a vibrant space for people, and people will want to go there, and it will increase the numbers, etc. From how well is it going? I guess we seek the feedback of the people that use the service. They are the most important, and they tell us, and not afraid to tell us and share their opinions and their views and their significant others in their lives too, their family. So we have that mechanism where we seek that feedback. We have regular meetings with the commissioning team, or Wokingham, who where we present KPIs around how well we're doing in the service in terms of occupancy, numbers, sessions. All of that sort of information is shared. So there's quite a lot of input into how well it's going at any one time, and that comes from various sources, whether it be commissioning, the people we support, our own teams. So I feel confident that we will get to know how well it's going really quickly.
You know, and I hope the engagement work that we've done today, you know, helps with that transition, because that listening exercise and the purchasing of the TV and the raised beds and all the rest of it, I think will help with that. So hopefully that will pay off.
Are any of the proposed cuts by the central government going to affect this at all? I know the central government continually is trying to cut the amount of money that councils get, and I'm just wondering whether it will be at all. I hope it isn't, but I don't know. There's only a limited amount of money, and with all the new ideas they keep coming up with to wind up charging us for more things, I'm just wondering how it's going to affect it. That's all.
Well, I suppose this is a kind of solution to some of that, I think, in that rather than trying to find money to prop up an ageing building, we've got an empty building that we can move into, and that will work. That means we can protect the service and keep it going, and then that releases a site, you know, which can be sold, you know, subject to approval. But that would, you know, that would then bring money into the council to protect those services for as long as possible, to deal with that very issue, you know, that you raised, which is, you know, a real issue for us.
Can I just add to that as well, though, that by supporting people in this service, it keeps them able to live at home with their families potentially and out of other longer-term care, like residential care, for example. So we see this as a real benefit to people.
Excuse me. Any more questions? Can we move to a vote now, please? Can I have a show of hands in favour of this report and ask Matt in that part of that to come back to us in 6 months and update us on how things
Can
have
we just
moved on?
be clear on what you're voting? You're voting to recommend, to endorse the recommendations to the executive?
Yes.
Okay.
Yeah. Okay, show of hands, please. That's unanimous. Thank you. And if Matt can update us in what we think is a timely period, I think October may be too soon.
October will be too soon, yes.
Yeah. So 6 months or something?
6 months after that,
Yeah.
yeah, I think. So that would be late spring, is it? Something like that? March.
Yeah.
That doesn't sound like that's spring, isn't it? Not late spring, that's spring. So March, yeah, just before we sort of break the municipal year, I think.
Yeah. Okay, that would be lovely, thank you. Thank you, everyone. There being no more business, I will close the meeting, and it's nice to see you all, and we'll see you all next. To see you nice, yeah. You're showing our age, Jackie.